Ladies and gentlemen, it gives me much pleasure to be here tonight for the primary reason that the government has been very much focused on improving the level of tertiary care in Fiji. One can argue that tertiary care, in the true sense of the word, has not been available in Fiji. For many surgeries, many procedures, many diagnostics, we actually have to go offshore. And to now have that ability to have that level of service being provided in Fiji through an internationally known brand is really a milestone. It's a huge achievement for Fiji. And I'd like to, of course, thank BSP and the MIOT group, and of course our friend. I thought he was going to speak and tell a little bit about himself, but I met him very briefly. He's originally from Lautoka, correct? From Nandi, sorry. Same thing, but Nandi's getting bigger than Lautoka now. But and who lives in Singapore and deals with hedge funds, etc. So I'd like to thank all of them for coming together, this wonderful collaboration to improve the quality of medical services in Fiji. There is no doubt, as has been acknowledged, that government's very attractive tax incentive has actually made this a reality today. I would hesitate to say that it would not have been a reality had it not been for the tax incentives that have been provided. Ladies and gentlemen, I'd like to take this opportunity to also highlight again also to the new Oceania hospitals and of course the good doctor, that Fiji still requires a lot more services in the medical field. There are many Fijians who are deprived of those services, many of whom because they cannot afford it, many of whom because they are actually not living in major city centers. So our need is there to be able to reach out to those people. Only yesterday I was with a group of doctors who have just completed their internship. There's about 75 of them. And talking to them about the level of service that we need to provide, talking to them about the need to be able to have decentralization of our services and how we actually in those decentralized stations, nursing stations, health centers, actually need to have doctors as opposed to them simply being serviced by nurses. And government, as you know, of course, is now giving scholarships in the medical field. We have also now changed the policy where every doctor that is working in a public health system, we actually pay for the postgraduate studies also at the Fiji National University to be able to reach that level of specialization that is very much critically required in Fiji. I also hope that with MIOT coming on board and Oceania hospitals at large, that we are able to have a lot more synergy, a lot more collaboration between the public health sector and the private health sector. I think that is very critical. Unlike India and unlike other countries in Africa and various other Asian countries, we do not have the economies of scale. The reality is that Fiji does not even have 1 million people, yet we are the second largest Pacific Island country. And when you go overseas and you tell people about this, they actually find it very hard to even fathom the idea that a country can only have 900,000 people. And then when you tell them that there are other countries in the Pacific that has 50,000 people or 12,000 people, they even find it even harder. But the reality is that we can create those economies of scale if Fiji becomes the center of medical excellence in Fiji. And as you quite rightly pointed out, I think Malakai pointed out, that indeed we can reverse the trend. We hope to, and this is government's view and vision, that with excellent professional medical services being provided in Fiji, we can actually have Australians and New Zealanders coming to Fiji for procedures. I understand the Medicare in Australia now allows for procedures offshore. They allow for it to be paid through the Medicare system. But what a fantastic place to come to Fiji, to have some procedure done, to have your treadmill test, your cardiac tests, all the other things being done, and having a 2-week break on a fantastic beach at a resort, or having a surgery and recuperating in Fiji. This is a reality that we want to achieve, and it is very highly achievable. So we hope that the Oceania Hospitals Limited does not simply look at volumes through their own hospital, but how we can collaborate with the public health sector, how we can get young Fijians to be as enthusiastic as your father, to have that level of patriotism, because unfortunately in Fiji, for a number of decades, previous governments did not invest in our human resources. When doctors wanted to leave, there was no incentive for them to stay back, nor were they enticed to stay back. We have recently increased doctors' salaries by up to 80%. And we are offering postgraduate studies. We want more Fijians to stay in Fiji. In the same way, there are other professional areas where some Fijians have left previously, and we want them to also stay back. And the only way we can do that is to be able to provide them with a good career path, to be able to provide them with a level of specialization, which includes exposure not only to medical training and various experience, but also the right equipment. And we hope that with your investment through the Oceania Hospitals, that we'll be able to achieve that. Because after all, ladies and gentlemen, to have a healthy society, to have a healthy country, to have healthy citizens, you'll be able to increase your level of productivity. You'll be able to increase the quality, improve the quality of life that we all experience as Fijians. So once again, congratulations to the team, Oceania Hospitals, and all those who've been involved in it. We are very much right till the last hour trying to sort out all the tax issues. I'm glad that we've got across the line. Those of you, probably not an appropriate thing to say, but there are many investment opportunities in the medical field. So those of you who are thinking or to invest, please do not hesitate. There are many other areas that you can invest in the medical field, and of course you can collaborate with Oceania Hospitals Limited. So vinakava kalevu, and we look forward to Oceania Hospitals having a very successful time, not just as a commercial enterprise, but as an enterprise that will spread the message of a very noble profession and provide that level of service that we all Fijians require. Vinakava kalevu. Thank you.